Hi, I am Dr. Mu, a gastroenterologist in Everett, Washington. I am here to give you a general introduction to colonoscopy bowel preparation, which is the most basic and critical requirement for a high-quality colonoscopy exam. The purpose of this educational video is to help you take the bowel preparation as easily as possible and prepare your colon adequately before the colonoscopy. The practice guidelines require that we repeat a colonoscopy if the bowel preparation does not permit adequate visualization. A poor bowel preparation will be unpleasant and should be avoided. I will first show you some good and bad prep examples. This patient had excellent bowel prep and as a result had a high-quality colonoscopy exam. Here are 4 examples of poor bowel preparations. As you can imagine, colon polyps can be hidden behind the stool particles and easily missed. In the left upper panel, the stool was watery but cloudy with stool particles. This is inadequate. As shown in the right upper panel, medicine granules were present, which made visualization difficult and often clogged up the scope channels. For similar reasons, large vitamin pills, corn, peas, nuts and whole grain foods often make the bowel preparation unacceptable, as shown in the left lower panel. In the right lower panel, marble-like stool balls were retained in the colon. This is often caused by constipation and/or severe diverticulosis. How do you know if your bowel prep is adequate after you complete the bowel preparation? Here is a research study published in 2015. You can assess your bowel prep quality by looking at your toilet bowl. Picture A in the upper panel is good. Pictures B and C in the upper panel are probably adequate. Pictures D and E in the lower panel are likely inadequate. Anything worse is bad. Some patients mistakenly believe any watery bowel movements mean adequate bowel preparation. The colonoscopy is an underwater camera exam. If the water is murky, your doctor cannot see. Sometimes stool particles come out in batches. Even if your stool comes out clear halfway through the prep, it is still important to complete the entire prescribed bowel prep solutions. Now, let's talk about how to get an excellent bowel preparation. Dietary modifications 1 week before the colonoscopy are critical. We humans don't digest plant-based foods very well. Absolutely avoid any seeds, nuts, peas, corn, and whole grain foods for 1 week. Also avoid taking any non-essential supplements formulated in tablets or granule capsules. Soft and well-cooked vegetable leaves are okay, but avoid potato or tomato skins and chewy vegetables. On the other hand, we do digest meat very well, so there are no restrictions on meat consumption. Also watch out for constipation. If you have constipation and do not have daily bowel movements in the week prior to the colonoscopy, your bowel preparation will probably fail. You should take over-the-counter laxatives or stool softeners to have at least 1 bowel movement per day. The bowel preparation instruction tells you to consume a low-fiber diet, which can cause constipation. You can replace dietary fiber with commercial soluble fiber powders such as Benefiber, Citracel, or Metamucil 1 tablespoon twice daily. On the day prior to the colonoscopy, you should be strictly on a clear liquid diet. Some patients become hungry and eat solid foods. This will ruin your bowel preparation. If you're really hungry, in the morning before you start the bowel preparation, you may drink 1 to 2 cans of Ensure, which is a supplemental nutrition drink available in grocery stores or drugstores. In the afternoon or after you start drinking the bowel preparation, you may drink some clear sugar water to relieve the hunger sensation. We do have extra dose bowel prep protocols for certain patients. Several conditions and medications often cause bowel preparation failures, such as constipation as discussed above, severe diverticulosis, Ozempic or other GLP-1 agonists for diabetes or weight loss, or a history of failed bowel preparation in the past. If any of these issues apply to you, please ask for an extra dose bowel prep protocol. You may also notice that we have added simethicone to the new bowel preparation regimens. This is based on recent studies showing improved adenomatous colon polyp detection rates. I'll explain how it works in the next slide. As you can see in this patient's colon, solid stools were eliminated successfully. Yet visualization was still poor due to the presence of gas bubbles covering the entire colon. They are caused by bile, which serves as biological soap in our intestines to help digest fatty meals. As you can imagine, soap creates bubbles. Simethicone is very effective in preventing and clearing them. By improving visibility, it improves colon polyp detection rates. You can buy liquid simethicone from almost any drugstores. The brand name is Mylicon. It is a liquid medicine, and it comes with a small syringe for measurements. This is a general introduction about how to and how not to do your colonoscopy bowel preparation. When you get scheduled for your colonoscopy, you will be given a specific bowel prep protocol. Please read the entire instructions right away. If you Google the phrase, WWMG GI pre-procedure instructions, you will find this website, where you can download your pre-procedure instructions. As you can see, we have many different options including Miralax, GoLightly, Suprep, Sutab, and Plenview. You may ask me, Dr. Mu, which one should I use? GoLightly has been the time-tested regimen for over 30 years. Unfortunately, it has a large volume of 1 gallon, and is not well tolerated by some patients. The regimen of over-the-counter Miralax plus Gatorade offers a reasonable alternative. It is better tolerated in general and provides a reasonable bowel prep quality. Thus, it has become the preferred option by many patients. No matter which regimen you use, dietary modifications ahead of time are essential. Also remember, some patients will still need an extra dose regimen,